Good morning, everybody, and let me welcome everybody to the Subcommittee on Oversight and Investigation of Energy and Commerce. We convene this hearing of the Subcommittee on Oversight and Investigations today to examine the efforts of the Department of Health and Human Services and the Centers for Medicare and Medicaid Services to address fraud, waste, and abuse in the Medicare and Medicaid programs. This issue is of great importance to us. During the Congress and the last, I introduced the Medicare Fraud Prevention Act, which would increase the criminal penalties for those convicted of defrauding the Medicare program. As a member of Congress from Florida, I've personally seen how this issue can greatly impact my state and its citizens. During my town hall meetings last week, many of my constituents showed and shared their concerns with stories about waste, fraud, and abuse in Medicare. Recently, the Government Accountability Office listed the Medicare and Medicaid programs as, quote, high risk. High-risk programs are identified as having greater vulnerability to fraud, waste, and abuse and mismanagement. As much as $60 billion is lost to Medicare fraud every year. This is an estimate because the exact number isn't known. When my staff asked the folks from CMS how much fraud was being carried out, they had no idea. So it's hardly news that the Medicare and Medicaid programs are at high risk. GAO has listed Medicare as high risk since 1990 and Medicaid as high risk since 2003. Over the years, this committee has had countless hearings on this subject, and yet nothing seems to change. The volume of Medicare fraud and the corresponding cost to the taxpayers continues to go up and up and up. Meanwhile, the stories we hear from states like Florida continue to horrify taxpayers. News reports have indicated that Medicare fraud is rapidly eclipsing the drug trade as Florida's most profitable and efficient criminal enterprise. With Medicare fraud, the penalties are lower and the threat of violence is non-existent. Meanwhile, seniors who notice that their Medicare number is being used for fraudulent schemes often find themselves begging the government to do anything about it, often with no results. The types of fraud we're seeing run the gamut, from fraudulent billing schemes to the actual creation of fake storefronts to sell durable medical equipment and then bill it to Medicare. Once the criminals get their money from Medicare, they close up shop, open a new storefront in a new location, and start the scam all over again. The administration says that additional measures are being put in place to screen Medicare providers and suppliers and halt payments when there are credible allegations of fraud. These are good, and these are necessary steps to take, but only if they work. But GAO has said that there is much more work to be done. In 2014, the administration, healthcare, will implement massive changes. Medicare will be cut and Medicaid will expand. According to the chief actuary of Medicare and Medicaid, 20 million people will be dumped into the Medicaid rolls and $575 billion will be cut from Medicare. While we are all committed to repealing this onerous law on this side, we must also do our best to end fraud before 2014. If we can't stop fraud now, how are we going to do so while simultaneously adding 20 million people to Medicaid? We have to make sure that the focus remains on preventing fraud and abuse. Unfortunately, CMS uses a pay-first, check-later system. That must change. We need to check first and pay later before taxpayers' funds are wasted. CMS needs to fix its verification system to prevent these kinds of crimes, or we'll never get a handle on this problem. Every dollar that is lost to fraud is one that is not spent on Medicare, medical care for those in need. Fraud raises the cost of health care for all Americans. Since Obamacare will raise those costs even further, it is absolutely necessary that we get a handle on Medicare and Medicaid fraud. So I look forward to hearing what the federal government is doing to get Medicare and Medicaid fraud and abuse under control.